You can put the floor.
All right. Well, thank you. Last week I met with Jesse and I, Rosemary and I, to talk about the Sunset Manor in Waverly. For quite a few years, we have struggled with staffing, and over the last couple of years, it's continue to get worse. I would assume possibly through COVID, as we all know, we've struggled to find staffing throughout all of our industries that we are around. And so, but we've made it work. We've had temporary help through agencies that's helped us over the years. We also have summer help, as in students for high school or college that are home for the summer, and so that's helped us through the summer. Most recently, this past year, we've struggled greatly with staffing to the point that it's becoming a concern. And what I mean by that is that we've reached out to agencies or travelers, what we call them, to help find us CNAs, certified nursing assistants, CMAs, RNs, and they're unable to find us anyone that wants to come work in a nursing home in Waverly. And so, unfortunately, across the nation, nursing homes are losing staff right and left. And it's a variety of reasons. People are tired of that area of healthcare, and also are just looking for new options and in healthcare, and they can. And that's what I always say, the luxury of healthcare. There's so many options out there. So recently, like I said, we've received one out of numerous traveling companies to find us a CNA, which we use them every day, but no one else has been able to find us anyone else. And we've branched out beyond the local ones, but also nationwide. Also, we have had a slew of resignations, and so I'll give a little detail what that means. We have lost staff over the last year or so because they want to do something different. Recently, we've had a few associates that turn in their resignation because they want to get out of healthcare in general, and they want to go do something different. And so, unfortunately, they don't want to stay within even the family of Coffee Health System. They want to go do something different. We've met with them individually to see if they would be willing to come to the hospital and stay in the organization and do something different there, but that's been no. One person is going to stay home and with their new baby. Other people are going out and doing other projects or other options that are not healthcare. So unfortunately, we continue to lose staff, but I want to make sure I come across to everyone in the room and county commissioners that no matter what, we're delivering the best care we can, and we're going to continue to deliver the care that we've always done. Now, that has cost us we have staff who have worked numerous days in a row. I'm talking 21 days, 24 days in a row to help keep that wonderful care. I don't want to scare anyone. I'm not here to scare anyone that we're not going to continue to deliver that care, because we are. But unfortunately, we don't have people who want to work in a nursing home setting and in Waverly, Kansas. So we have to come to this decision and to make a different approach here, and that is for us to close the facility. We have currently 19 residents, and we currently have about 19 full-time staff members. Now, we are already, as of today, end of last week, working with the residents and their family members on trying to find replacement. We have 7 who have found placement elsewhere, and we're working with the staff, meeting with the staff one-on-one, and that started today, just to figure out where in the organization would they like to go. So we are meeting with them, trying to find another opportunity within the organization that best fits them and something that they would be interested in. And so last week, our board meeting, and Rosemary Rich is our chair of our board meeting. Our board, we met and we presented this information as the team of executives and our director, Suzanne, who's over the facility, to the board, and let them know that we do not see another option as we continue, like I said earlier, to look for staffing and recruit staffing. And I do want to back up a bit about staffing and our salaries and our wages, because there's been some rumors that we don't pay minimum wage and we don't pay enough money. So we utilize Kansas Hospital Association data, we call it KHA, and so they give us every year salaries in healthcare, and even by region, Northeast region, the whole state, Southeast region, and so on. We use that information. We also use Gallagher's information, and we pull those together, and that kind of helps build our pay scale. Well, I'll tell you, we are $2 over for CNAs, one example, of what KHA and Gallagher's recommends for our region. And we're still not getting applications. So also about 3 months ago, we started what we call windshield time. If you live greater than 25 miles from Waverly, we're gonna pay you 1 hour drive time every shift that you work. And so in the past 3 months, we've received 3 applications, and we've hired 2, and 1 we've already fired. So we are struggling, unfortunately, again, to get staff. Now, move forward again to our last week board meeting. This was presented, at that time, the board voted, it was motioned and approved and seconded, and it was motioned to start the process of closing the nursing home facility by end date of January 15th.
I would just like to say it was not an easy decision on anyone's part. We've been discussing it from different perspectives much longer than a year. And it was not a decision that anyone made lightly. But based on the facts that we were presented, that was the decision of our board.
Now, as my understanding, we visited on the phone, we didn't visit in person.
Correct.
Did you say there's some new guidelines coming down
That's true.
from wherever that's gonna require more staffing for a facility like that?
Correct. So nursing homes, healthcare in general, and we have a prime example, someone that could chime in anytime, James Higgins. Thank you, sir. Who used to oversee our facility there and is now retired. And so CMS, or the federal government, regulates healthcare in a variety of areas, but the nursing home side of things is much more stringent and higher requirements. And so they tell us, for example, we have to provide so many hours of activities for the residents a week. We have to provide a certified dietary manager for that facility. We have to provide so many hours of this person and that person. And so, unfortunately, those are changing, those are increasing to where now I'll just give an example, you have to provide more hours of activities a week than we did before. So those are changing within the world of nursing as well. Used to be the director of nursing could have to be in the building for so many hours, but now it's up to 35 hours. They can't be helping, the director of nursing has to have that 35 hours only as a director of nursing. They can't be director of nursing and helping pass out medications. They have to be separate. And so there's definitely, thank you for bringing that up, there's definitely regulations that we currently follow that are pretty strict, but also they're changing as we speak to a little bit more.
In addition to the Centers for Medicare Services and Regulations, we also are governed very strictly by our state, and we have a lot of state regulations on a myriad of things that have to be followed as well. And so we have a lot of different things we have to look at and evaluate with. And for example, on the staffing ratio, staff to patients, that's one ratio that we have to look at in terms of how many staff we have to have on the schedule for that particular time and day. And that is lessening. Just this month, I think, it was a new regulation for a more intense number was going into play, which would require more staffing than we've had to have in the past.
Joe, did I understand correctly that there's been a little bit of discussion along this line for the last 12 to 15 months on a possibility we may have to shut it down because of lack of help? And you've met with the commission 3 or 4 different times here in the last 8 or 10 months, and even up to 3 weeks ago, when you were in, you know, you presented some very, very positive information, some information we really like to hear. And I mentioned that, you know, this is great news. We appear to be headed in the right direction. And then 3 weeks later, this happened. How can something like this happen without a little bit of information getting out?
Well,
I
right.
feel like we've been, and I'm a strong supporter of the hospital. I feel like we're being misled.
And I hope that you don't feel that, and I apologize for that. That day, yes, I did give an update, mostly
It was a
around the
good
finances.
update.
Correct. And we have worked very hard, the team, the finances, and I'll just be very transparent. We have made great changes in the losses of that building itself. We have improved the losses. Last year, that building lost $888,000. This year, we're planning, looks like to lose $520,000. Now, I want to remind everyone here and present, it is not about the money. The county has graciously helped us continue to run our facilities, even though some of them are at a loss. So the financial side isn't it, but we have made great improvements on the financial side of how we order supplies, or how we maybe we do more bulk ordering instead of periodically ordering, things like that. So I apologize if I misled you that day, but we also, that's the same week, we got 4 resignations of 4 full-time associates that same week. And we felt like we were still asking agencies for nursing. We were the last that I heard, and I was following up on it today, because we were asking nursing. So how that works, when we talk to agencies, we say, well, how much is a nurse going for per hour? And then they give us a range, and then we tell them, okay, we'll pay $105 an hour. So right now, we're asking for nurses to come help us at that facility through agencies at $105 an hour, and no one's taken it. And that's agencies. That isn't someone that we would pay to come off the street and hire on with us. And so we were still hopeful, but it's been months and years of struggling with staffing. We did have the summer help that helped us get through the summer, but then when you're starting to lose nursing, because those summer help are usually your CNAs and CMAs, now we're losing our nursing to other areas of
Has there been any exploring done to see if there's other firms out there that may take the Sunset Manor over?
we have not.
Any exploring at all?
We were working through KDHE and the Kansas Department for Aging and Disabilities, and we've asked them to let us know if they know of anyone. That was as of last Friday, but as of now, we have not heard anything back.
You know, it seems like it's been in your mind for the last year, and with a nursing home, it is very important that it is open if it does sell, from what I understand. And you can correct me
Now
if
say
I'm
that one
wrong.
more time.
That it is open and operating when it is up for sale.
Versus being closed.
Being
Close it,
closed,
someone comes.
because once it's closed, all the paperwork's gone.
And I could see that, because I know of other communities where they've closed and they're still for sale.
Yep. That's a major hurdle to get it sold once it's closed,
As a nursing.
as a nursing
As a
home.
nursing. I know it was a shock when you called me there Thursday morning, I think it was, you know, because my grandmother was there and passed away there, and my aunt was there and passed away there, and so it's something that we don't like to see happen as a county, and as a county. So,
Another thing that I would like to share is that, with regard to the staffing shortages and the regulations that exist in terms of the staff to patient ratio, There is the possibility, of fines involved if we were to be found that those were not being met, and they're significant fines. And certainly impacting Sunset Manor, but impacting our county health system as a whole as well.
So if I can speak, I'd like to speak. So I support what Jobin has said. I agree. He's been above board with everything that he said. I personally, now that I'm retired, I can say this, I don't personally agree. I thought it was a little bit of a knee-jerk reaction that we, boom, in 2 months, we're gonna close. Now that bothers me a little bit. But on the other side of that, I will tell you that the hospital is trying to operate a long-term care facility on limited funds. And I understand that you provide some supplemental, but I sat at numerous commission meetings and with the commissioners saying, if I had a business that ran like this, I would shut it down. That was said by the commission on numerous occasions. So at the same time, the hospital's trying to run the facility on what limited funds that they have for that, and still losing money, no doubt about it. But, so it's hard to all of a sudden say, I'm gonna raise the wages of the employees and try to look back to the commission and say, well, we're trying, but you're spending more money. So I don't know what the answer to that is, but I mean, I personally would rather see the place if in fact that it was a decision to close it, that there'd be a couple commissioners, a couple hospital board members, a couple public members, and look and see if there's any other options to do that. And, you know, kind of, and then have everybody's input into saying that, because you got commissioners thinking one way, you got a hospital board thinking one way, and then you have all these family members thinking another way, and nobody really knows the whole answer. I can tell you that I personally was involved in it for many, many years, and every time we'd have this discussion, I'd go, whoa, we can't shut it down, because, you know, this is families. I mean, you uproot a family member, your mother, your father, whoever it is, and you uproot them and you put them into a place there that all of a sudden becomes their home. I mean, it's heart-wrenching to go up there and say, Mom, we're gonna have to move you. You know, that's what they live their lives, and they're ending, that's where they go to die, realistically, at the long-term care facility. And now we're gonna uproot them, move them somewhere else, totally foreign to them, not know anything. So I think it really needs to be looked at, and I think the commission needs to support the hospital, whatever that decision is. 12 years ago, we looked at it. In 2012, we looked at it and says, we're gonna close the nursing home down. Then we were gonna close it down because it was a poor facility. It was terrible. And so we hired, the commission paid for it, paid for somebody to come in and evaluate what we need to do. And we did some of those improvements, but we couldn't afford to do all of them. But we've continued to operate like that ever since. So there's nothing been really changed. Fortunately, it lasted another 10 years. And now we're at that again, but the COVID came and caused a lot of this stuff. And as you know, there's a lot of businesses out there that are closed because they can't get help. Well, this is a little bit different help, because you gotta have certified help. You can't just get anybody off the street. So that's the trouble right now, trying to find that qualified help to move in there. I don't know what that answer is, but I think that, I know the state is concerned about, us closing that facility, KDAD's, and, so anyways, I think it needs to take a second look for a little bit, and, I think 2 months is rather quick, or a month and a half realistically, 2 months. So anyways, just, food for thought.
So to add to that real quick, so in 2012, 2013, as James indicated, the building needed a lot of renovations, and some of those have been done. It wasn't staffing. Back then, we had 40 employees. Today, we have 18. And we're gonna lose 2 more by the end of this year because they already gave us notification that they wanna do something different. So again, it comes to the workforce that's not there, and there's no workforce in the labor that we cannot find. Now, the 60 days is what's required by CMS, the 60 days, and so we did try to give a little extra to that, to add to that, because as James said, his mother is there, as you indicated. Those associates that work in that building, as many of you know, if you have loved ones, and I had a grandparent in a nursing home, we were there every day. And those residents and, but also the associates became our family. And I understand what they're going through. And that's why our HR department is there all day, every day this week. I just left there for a few hours. We're gonna be working closely with those associates because they're struggling as well, because they've come to be like family to them. So, we do hear you and understand what you're saying, that it's, like family and once you start meeting those associates, but also, I remember when my grandma was moved from one wing to the other wing, just one wing was hard for her and the family.
I just wanna say that I am one of the, I'm Jesse Knight, and I am one of the commissioners, I am a commissioner that has constantly said that the hospital needs to turn things around, and lose less money, I guess, is what it boils down to, and that was the first question I asked, is this money related? Is it money related? I was told no, this is staffing related. You can't make people work, you can't. I've done it for 30 years, you can't make people work. You can't get them in off the street to hire, and you keep 1 out of 3, and it's sickening, the workforce that is out there these days.
So I know, Mike, I will tell you, so several years ago, as we were trying to, reduce expenses, et cetera, whatever, so we reduced the facility from a 30-bed facility to a 25-bed facility. So that, helped us for staffing wise. And so, that's the next shoe to drop. You could probably reduce but you still gotta have enough in there to kind of break even. But,
Very good point, James, and sorry to interrupt. We were the 36, and we went to 24, and now we're at 18, or 19. We already were making plans, before we made this final decision to even keep dropping it down, as the numbers change. Because, even to the point of, would it be 12, 10?
What's the magic number? Whatever you got staffing for.
And that's why we were
What's that patient
starting.
ratio now? What is that? You keep talking about it.
So it's like 1 to 4 it varies. So if we want to, CNAs, CMAs, nursing, it all varies, and some of it by hours. So like I said, so the director of nursing has to put in 35 hours in the building only as a director of nursing. So a variety it all varies. 1 to 4 is for nursing.
With a short notice, is there any way the hospital board would look at saying July 1st? And because we all know what's going on, get more aggressive on trying to find a new buyer? The 2.5 months notice to me is, I don't know what the right word is, my vocabulary ain't that big. But 2.5 months is way too short to pull the plug on something that's been so important for so many families, for the community of Whaley, for the citizens of Coffee County.
I think we're gonna come to the point which we're there, is we don't have enough staff. And I can't keep people working 24 and 21 days in a row. I have to make sure we continue to deliver that care and not have injuries to residents, staff, and the potential fines as well.
I have a concern moving family in January too, out of there. When it's cold and everything.
And we're meeting with them on a regular basis, the families. I know some are looking at as soon as the next week or 2.
You're not meeting with families on a regular basis. I was called Thursday at work in the middle of the day and told about it, and I'm in there all the time. A little bit less with outage, but still managed to get in there weekly and called. Plus, they asked me to tell my mom then, and I had to tell her on the phone, and she has dementia. I couldn't get away to tell her, and she doesn't understand that. So nobody's been working with this family member to prepare us for that, so that I could have found the time and made the time and did it, besides getting called at work. And if it's an emergency, yes, I would leave, but they wanted me to tell her right then.
And the community has been blindsided by this. If we had known, I don't personally have anyone in the facility, but this is gonna be a big economic bang to our community, to Waverly. And if you got the community and look at the information out there, which everybody was blindsided, who knows, somebody says, you know what, I know so-and-so, and, you know, go through, get the information out there, and could possibly get more help. But we weren't even given that choice.
If I could offer another option that, you know, I mean, Joe and I have talked a lot about this over the years, since he's been here. But could, Sunset Manor go through attrition as patients leave or patients, die or whatever, then you reduce your staffing as that goes along, and then you not be able to take anybody else until you have, or can have adequate staffing. So if you're at 19 residents now and you lose 3, what's that look like for the staffing
Already
pattern?
left 7.
Huh?
7 have already left.
Well, you said 7.
In the process.
But maybe they wanna stay there, I mean, I don't know, and so then you look at that, and then, in the meantime, you still try, and certainly you're not gonna recruit anybody when you're not taking on any residents, but at least maybe the people that are there now can get a little relief, because they won't have to, you know, because I understand staffing, and then that is the biggest problem out there, staffing. It's
So
been
would a
that way.
committee, would, like you talked about earlier, would there be a way to form a committee that could look into it a little bit more? Is there anything, any avenues left to go with staffing?
I mean, I'm gonna be very blunt, and I would say I don't see that changing anything, to be honest. I mean, I've heard people say, well, if the county gives you $1.2 million or $1 million, that won't help. I mean, I don't see how a committee or, because we've been, and maybe we haven't touched base with the local people who live in Waverly, and, but we,
Not at all.
and I'm not saying we haven't,
Not at all.
I'm just saying, we reach out to all the healthcare organizations out there that provide staffing. We've posted on all of the Indeed, social medias on trying to find staff to come there. Like I said earlier, we down to windshield time, we're $2 or more over what is recommended for, or shown for our region. And we're also working with the USD 243 Libro and Waverly School District on providing daycare for our staff members. We already do that here in Burlington. And so we're providing them another avenue to come work there, another reason to want to work there. And we're still long into the process.
$2 an hour over,
Pardon me?
$2 an hour over $105 an hour salary doesn't seem real aggressive to me.
And so I wasn't.
That was for the
That's for my-
position, I believe.
Right, so I was given one example, which is for our certified nursing assistant. We went over the $2 more than what KHA or Gallagher's showed us the number to be for our region. And when I refer to the $105 an hour for a nurse is what an agency charges for a nurse, and that's at 105.
That 105 is a placement program, is that correct?
Not a permanent contributor.
No,
Yeah.
but you're paying $105 an hour for that agency to provide,
Correct.
and so they pay the nursing staff that they would find. or-
Whatever they
Or
pay.
whatever they pay, right.
I have a question. I think I've heard you a couple times anyway mention in Waverly, they don't want to come in Waverly to work. What if we have a nursing home, a new nursing home, or a better facility in Burlington that's in the middle of the county? Would we be able to get workers to come to a little bigger town? I'm not against Waverly at all, don't get me, don't anybody get me wrong. I'm not referring to that, I'm just saying, I've heard you say, they don't wanna come to Waverly to work. So, is there a possibility we could put
It
in
has
a
been.
different building?
No, Waverly, just the rural setting, the nursing home setting, but then we struggle with people that we think that we're gonna get, and they say, well, I'm gonna go work at the distribution facilities in the Ottawa facility, and we hear that quite often. So the location is tough in multiple ways. You know, it could be an opportunity in the future to look at. I know that in
I've been told
2012.
this week of a girl from Burlington that has a nursing degree, she's young, unmarried, no children. Another one, unmarried, no children, she's from Emporia. She has a nursing degree. They both work at KU. They want to get out of Kansas City. They want a job here. If we pay them, they'll come. And that's just who I know.
And if people are leaving to go to the distribution center, that comes right back to pay. Because people go there for what they're being paid. So back to the, I was wondering if you're not offering that.
We use resources that help us guide to that. So we
Well,
use the
maybe their
North.
guide as well.
Resources is out the door since COVID.
Well, that's very true, very true, very, very true. I mean, that's why we, continue to bump up to stay competitive, because we have to look at the other facilities around us, especially when you're talking long-term, that are for-profit, who are offering more. And so we are now comparable to them.
So what is the $2? What is the CNA, the $2? What were you offering for the CNA position?
So that is, I'm gonna say 14, I wanna say 14. 16, that's right, it was 14, we bumped it to 16.
I was in talking to somebody at the hospital over in HR, and they said they offered as much as $37.50 to the travelers, I assume, for a CNA position. That's a pretty big difference. So why does that money have to go to traveler? Why can't it go to the facility?
Kind of going off of what James said a while ago, and kind of back to the $105 statement, we would never be able to maintain such high
But
salaries.
if you're offering to pay somebody that amount of money to get them here, you fully intend to pay them that amount of money to keep them there.
We would like.
Let me add something else real quick, sorry, Bill, but, so, when you hire agency, if you're an agency worker, you have the opportunity, it's like working as a substitute at a school, you have an opportunity to say, I don't wanna work today. So that's what agency does, you call them and say, I want agency, and then I need agency for this much, and they say, I can give you this and this, that's it. So that's the beauty for those people of agency, that's what they do, so you could pay them what you're paying the agency, but you won't, because they don't want to work every day of the week. That's what the society today, that's why they don't want to work all the time. So that's part of the challenge. And then, when you start paying the higher wages to the agency, he who has the deepest pockets wins. So the big for-profit corporations, they suck them up at a lot more money that you can't pay. And, it's a hard sell.
Didn't you just hire some new CNAs at the hospital for $20 an hour?
Yeah.
Did you just hire some new CNAs at the hospital? What amount of wage do they make?
Well, it greatly varies on their experience and what they come to us with, how many years' experience.
Owned by the hospital as well. Is it full? Is there a way that part of that could be a nursing facility,
we've talked about
consolidate
that.
them?
We've looked at that and talked about, we have a request for a representative from KDAS to come out and look at our facility there and to see how that would look with the apartment setting.
When did you start that?
Last week.
Last week. So, again, his suggestion of a committee or something to look more into that, could we not figure something out in the short term of it to try to get those answers before you just shut the doors? Is there any, I understand staffing is our biggest problem. More pay, I don't know what we need to do about it. Brainstorm about that. And within the time that you gotta have somebody come look at your medic. But that should have started a long time ago when we were having problems in the first place.
So I will, so just in defense of them, so we started that long ago, started talking to KDADs about different options for that, so.
We've asked them to come out just recently.
And
look.
it's hard to get those people to do it, so we have started that process quite some time back, but not to the point of this.
So there's a
Like
staffing,
a week, it's just
Seems to be behind the ball.
I was gonna say, there's a staffing problem for Waverly, but not if it's in Burlington.
Oh, we're still there, right?
No, just combining facilities maybe and staff, an option. I mean, just, that's what I said, have we looked at every avenue? Do we have enough people looking? And my comment back to you haven't been working with the families, which I'm very disappointed in. Because it would have given us a chance to at least talk to them personally, or, try to come up with things, something a different avenue.
I understand what you're saying, but I will tell you what our timeline was. The board made that decision, a week ago today. And, we called Mr. Knight and we called Jacob Marsh, the mayor of Waverly, on Thursday morning and had a conference call to let them know of that decision. And then the same day is the day that the families were contacted. We hope to get those people notified before the public started talking. I understand what
In a
you're
related
saying
story,
about
I
more
didn't realize
advanced.
that
giving me the information after you've made a decision did not assist my community in any way.
No, it should have been long before.
Right.
All that did was put me in a position to know him before anybody else did, which was pretty uncomfortable.
I guess if it was having all of these issues for a while now, I was having my note there. I guess I would have liked to have known that for a while, like, hey, we're looking at this, we're having this may happen down the road. This is what we're looking at.
I think there's probably some hopefulness behind the backs of the hospital board and the executives that maybe it would turn around, something would change, but, then you just get to a point where
But Waverly's a strong community,
I
and
agree.
it's frustrating that this came out of the clear blue. You didn't give the community the opportunity, I know I'm repeating myself, to have a public meeting and come up with any ideas, any type of solution to have given us enough time to try to help find you help. And that has been denied. I agree with what they're saying. I think 2 months is very, very tight for these families to try to find where their loved ones, that's going to be devastating for those patients. I can't even imagine. It just,
It took me 5 months to get my aunt in a nursing facility. I'm waiting. So, yeah, the time limit is very short for these people to find somewhere else for them to go.
Yeah, the wait list.
And now you've kind of flooded the market in the local area with 19 more residents that other facilities are already short-staffed. So they get turned down, and what are they, they're kind of out in the cold.
And with it being the #1 facility for years, you would think that alone would attract people to that place, because it must be doing something right, it must be a great work environment.
but you need to pay more than what kids are going to McDonald's and getting $15 an hour. Yeah. That right there is just,
We've made adjustments to pay there 3 times this year already,
look
to
good.
continue to increase this.
Good.
As we know, the world changes around us, McDonald's, Sonic, or Casey's, correct. When I got here a year ago, you could probably go to Casey's and make more money.
Yeah.
And so we've made,
And which would have led up to the problem of what you're having, getting staff and having people leave. I'd seen that there's a young lady that lives in Waverly, and she's driving to Emporia and working at a nursing home there, and I'm like, how can you drive, especially with gas prices, drive to Emporia and not go down to the local facility? Darn well, right there, that would go back to pay. Even if she took a little cut in pay, it'd be cheaper for her to work there at Sunset Manor than to drive into Emporia. It's wonderful.
This opportunity of closing them is gonna hurt more than just Waverly.
Oh,
We're
that's the whole
taking, we're
area.
taking all these people away from their doctors that come, that's money in Coffee County. Probably their medicine, which I know, I see what my mother's is, I mean, we're talking thousands of dollars a month, a year, of medicine, and per month, really. And all that money is probably gonna go wherever they have to go. We're all gonna spend more gas money to go see them, because they're not gonna be as close as Waverly or Burlington.
Is there any working resolution, commissioners can help, any ideas that James has put out, is there anything, we can discuss how much we don't like this all day. Is there any path?
Well, that would be a question for the hospital board. Is this, is it something that could be reversed? Is it something that could be looked at maybe just a little longer versus just closing the doors? I
He
mean,
suggested a committee.
Like
I
you
think they
said,
could only do that if the commission supported that. In fact, if they're, because they may have to spend some more money, in fact, to find good employees.
we'll maybe drop, because they've already said there's some that's already being placed somewhere, so you're gonna go down to 11, roughly 11 residents. You have the staffing for 11 residents.
Those people made that choice when they thought there was no other.
Well, that might be true too.
Is that under pressure?
Would they stay, that's what I'm wondering, once the wheels are in motion, is it too late to put the brakes on
You can always
to
reverse.
help?
In
I
time
mean,
to look
always-
at the meadows, or if the commission would be generous enough to help them get a little bit longer, so we can look into that. So somebody can.
Jesse, I for one, I don't think it's too late to extend it. That's just my opinion. And I know we can't call all the shots, but, and we could sit here all afternoon and talk about it, probably not make any progress at all. Now, I'm not saying we need to shut the meeting down, but I'd like to see the hospital board, my opinion, to extend that out to July 1st and review and study every option that might possibly be available out there. And there may not be none, I don't know.
The way I'm reading into this, if you don't do something soon, possible fines would be assessed to that facility, am I correct? So,
Not
Coffee
fines,
County-
but there's, could be injuries to our staff, to the residents, license issues.
we're looking at safety issues more than anything. So, Coffee County Commission, Coffee County taxpayer can help financially all day long, but I think there's 3 or 4 business persons in here that say the staffing, finding people that want to work, that will work, is very hard to do. And like I say, we can throw money at this all day long as a commission, but we can't help them hire people. I guess we can give them more money to hire people, but.
They said that the staffing agencies staff those that pay the most, right?
They've already used 2 different agencies and are paying 4 times the going rate, and those agencies aren't able to find, workers for the facility.
So you chose every avenue possible, Dr. Michelle, to find more staffing,
Yeah,
and you felt you just come up short.
this has been going on for
Months.
probably 4 years.
Yeah.
3 years, right when COVID started, it got much worse. And this year, it's been really bad.
So what are the changes with the meadows?
What's that?
What is the
She's
changes
asking.
with the meadows? We talked a little bit. Well, now my question is, can it have a wing that's skilled nursing and then assisted living? Is there room for that? Is that a possibility? Is that,
That's
I know
definitely,
we're waiting for somebody to come look, but can we get through until that look happens?
yeah, I don't know. I mean, that's
We have to
definitely
talk
something that
to
we're
them.
looking at and trying to utilize, as little staff as you can to essentially, cover as many people as you can. Having 2 different facilities makes it difficult, but it's a licensing issue too.
Combine them as one and you can use
Right.
your staff and resources.
Right.
But the licensing is different. Right, and that's what he said that they looked at last week, is calling somebody to come look at that. That's what I'm asking, is what
Right.
all is involved, how long will that take, what does it have to do? Is that even an avenue that we
Yeah.
can go toward?
No, it's definitely an option, but right now the option isn't to keep 2 facilities open. Could we house everybody or some of them in the meadows along with the assisted living, that's a possibility. Could
Like
we
James
use?
indicated earlier, this is something that James was working on before his retirement, and he continued to try to work with different governmental officials, and it's been slow. And why I said that we asked for them to come out last week, because we're continuing to work the process with them, but we need them to come look to see if it's even an option, because we have an apartment setting that has a living room, a bedroom. Can one person be in the living room, one person be in the bedroom and share that bathroom, or is it only one person can be in the whole apartment? We have an exterior door. There's a variety of things that we've asked them to look at when they do come, because we don't know.
There's some different regulations, if you were to make part of that a nursing home or with the meadows, it's required to be sprinkled. The meadows is not sprinkled, so we don't have any sprinklers, so that's very costly, number one. So you have to put that in, at least one half of that, to be able to move those, but I mean, the idea is there. We just, we have to figure out what that is, how it can do it, and what's the cost, so.
I still don't see why we would take a functioning facility and try to move it into a facility that doesn't function as that.
So like, we have a facility that has a kitchen, housekeeping, laundry. We have another facility that has a kitchen, housekeeping, laundry. If there was an opportunity to combine, then you can only have one kitchen, one laundry, one housekeeping, if that makes sense. So that's where we were in the previous, looking at if we did combine, then we could help eliminate some of our losses and be all in one. That's what,
And you have how many at the meadows?
13 residents,
And you have how many?
26 apartments.
And you have how many?
19.
So what goes around and on, and some more people, affecting more people with your decision. I couldn't really shut meadows down if it's not sprinkled. I mean, it has other issues.
I hear what you're saying, but it's totally different. There's a different staffing required for the meadows versus long-term care. Totally different. You can staff the meadows with a couple people. So, and then a cook and all that stuff too. So it's totally different.
But we're still talking about not being able to staff it in Waverly, changing the meadows, and then not being able to staff it in Burlington.
I think staffing's gonna be a problem no matter where you go. I mean,
I understand,
I
it feels
don't know
like
what,
it's
I don't know what the answer is to
problematic.
that, so yeah.
If we had an answer, none of us would be sitting there.
And even if a person, instead of going to the agencies to hire somebody for $105 or $110 an hour, you go hire the individual for 40 or 50, you're still saving 60 or 50 or $60.
Well, this isn't a financial decision. I mean, it was based primarily on safety for residents and ability to staff. I mean, we have a nurse that's worked 24 days in a row without a break because there's nobody else to take their job. And then you have other regulations that are gonna be set in motion that we won't be able to fulfill those requirements. So it's, yes, the facility loses money, but that's not the reason for this. It's lost money for several years. But now we just don't have the ability to safely take care of residents.
But it sounds like part of the problem is the reason why you can attract help is because of the pay. It goes back, if you're only offering $14 an hour, went up to $16 an hour, that's a lot to ask. I don't know why. And to the point, like you said, instead of paying $105 to the placement company, use that other $50, disperse it. Everybody gets a pay raise, the word gets out, and you might get more help.
Yeah, you're probably gonna lose money, but at least you're gonna keep it open.
Yeah.
You might attract new nurses, you might attract RNs, I don't know. I mean, I don't have the answers. But, I mean, well, if I had the answers, I wouldn't be sitting here probably.
I'll touch base on what Dr. Shell said. I know one of your staff members there that is leaving you, and she said she worked so many hours, she just can't do it no more. So, sound like you're overextended.
And you're right about the cost. I get that, the salaries, et cetera. So we have our own employees that have joined those agencies specifically for that reason. So they can get that money. So,
And they can pick the days they wanna work.
right. But it's out there. We have 2 agencies. We can't get anybody.
It's too bad.
And the administration has done, they've raised the level, they've had other incentives put in place, above and beyond what's happening in Emporia and surrounding areas, and that's still not attracting anybody. And it's not just 1 or 2 people you need, we're down how many employees?
27.
So,
You've got 20 employees, so he said.
But that's across the whole health system, that's not just.
No, that is just.
Sunset Manor needs 20 more employees. For 19,
yeah.
Gotta have somebody there 24 hours a day, 7 days a week.
right.
I know it's information that nobody wants to hear, but I feel the board has made the decision, and the hospital board. And I'm not 100% for it by no means, but it is what it is, unfortunately. And it's painful for the families, it's painful for the residents, it's painful for the city.
It just feels like, we talk about transparency, and the last 4 or 5 times that you folks have been in, there's always been that word transparency. I just feel like that there wasn't any transparency on this, and someone used the word blindsided, and I feel like, not just Waverly, but the whole community that involves itself in that nursing home, there wasn't any transparency, and it's too late now, but I think that's where you failed is by not being transparent enough. That being said, I'm not sure what can be done, but that's part of the problem. Everybody talks about transparency, but when it comes down to it, it's not. And I think that's where part of the problem is.
What will happen to the building once it's closed?
It is
Hospital owns the building, correct?
through the county. But it is interesting because I will say, I've had a few people reach out and think this is part of the CHIP plan, or the future of the CHIP going up north, which it's not. Again, our priority is the residents and our staff and the building. We haven't got that part.
Are there any more questions, ladies and gentlemen?
I'm gonna say something, been doing pretty good getting my mouth shut so far, but I was the only one that's been here when we started giving the hospital chunks of money quite often and didn't get it back, and I kept saying, I'm all for the hospital 100%, but somewhere we're gonna draw the line. I don't know if I've drawn that line yet, but we've sure cut it back a little bit. But we, a few years ago, we had a hospital board that actually the commission wasn't pleased with. In 3 years' time, we changed 9 out of 9 hospital board members. And hospital kind of started turning around then. I feel like we have some good hospital board members. And I think that even though I kind of go with Steve, maybe it isn't transparent, but why would you want to even excite people that something might happen until you're pretty sure that it's going to happen which way that it did? So I'm not sure that they weren't transparent with us, but until they knew this is what we were gonna have to do. But I think we have a great hospital board, and I think they have probably done a lot of research into it. I don't think it was a click the finger decision. So it's bad, but if this would happen in July, would we still had the same reaction? Probably. So it doesn't matter, it's gonna happen. I mean, it happened. And I think it's up to the hospital board, if they decide they wanna reverse it, do something different, I'm all for it. But at this stage of the game, not knowing what I know, I'm gonna support the hospital board on their decision. That's why we have them, and I think they've done a great job, so. Even though I know it hurts some people's feelings, and there are some people that it's not what we wanna hear, but I just feel like that's my thinking on it. So.
The residents and the families come first. They should have done a better job about notifying.
Well, maybe that position, maybe that could have happened a little bit
Well, I feel
different.
like it was held back so they wouldn't empty out and leave before they were ready to make their final decision.
But that's your right to think that. Nobody will take that away from you.
I think as hard as it is to place somebody in a rest home, they wouldn't, 3 months down the road, they still might have the same number of patients there, you know, cause it's just, you just can't yank somebody out of a nursing home and throw them in another, cause you're waiting. I mean, there's.
So what do we do with our parents that are there and you can't find placement?
I know.
Is it my understanding that on January the 15th, if you still have some residents that are not placed, you will continue to take care of them?
I didn't hear that on my phone call, I've never heard that before.
I didn't say, I'm just
I
asking.
mean, I know,
That is correct.
but I guess it's kind of one of my other cool
Well, I'll follow up on
things.
I wrote your comments down, appreciate those.
Yeah, I mean, there was.
Because we need better communication.
Yeah, there was not any communication, there was none of that, no, I didn't hear that.
That's what you explained to me, that
I've
you'd
been
stay
making phone
until
calls.
all the patients were placed.
Today, what's the first time I heard that?
Yeah, that's not the way it was conveyed. It was conveyed that it was going to be shut down January the 14th. I mean, that's,
Where the problem's gonna lie is your workers. If they're, I mean, they're not gonna stay in a job that's gonna be, that's gonna be a lot of the problem. Is your workers. So if they can find a job somewhere else, they're gonna drag and roll on somewhere else. So once again, it's gonna come down to staffing, because at the end, they know they're going to be losing their job there. So if they can find a job somewhere else, they're
Which,
gonna
the
roll.
point of that also is, they said they're gonna send out packets. Well, okay,
Those are going
they're
out.
gonna be leaving, people are gonna be leaving, it's gonna be harder to keep people there, so they're leaving faster, we need to move faster. I don't have a packet, I don't have information. I, do have a friend that sent me the website so you can compare nursing homes. I don't know if everybody else knows about that, but you can look at their ratings and find, so, I mean, there's a lot of information, if that would have been given at the time, would help us to make those decisions. I just have to run the tapes
And those packets, they're there, they're going out today.
I want to clarify. They're going through the mail. Mail hasn't been worth a flip for the last 16 years.
I know, ever since you left.
There's
Ever since Bob left.
Ever since Bob left, yeah.
But I guess that would have been good, maybe to have, come in and, I think I would have preferred, face-to-face conversation versus a telephone call in the middle of the day. And then, hey, you need to tell your mom now. Like, okay, I can't, she didn't understand, but I did, and she didn't understand.
Another concern that I have, I mean, obviously, we all know where we're sitting right now, and I have a mother there. But what's the future for Coffee County for our elderly? I mean, we're in our 70s, and we've got a lot of baby boomers here that's all gonna be, and until you face that door at a nursing home with a loved one, you don't think about that future? But I think Coffee County better be thinking about this future. What are we gonna do, take all of Coffee County and send them elsewhere?
There is a shortage of housing, period, in Coffee County for anybody. And now it's even for the elderly, unfortunately, with it closing down. Yeah, there's issues with housing, period, in Coffee County.
Well, I'm talking about
When
we need to knock
Yes, I
on
understand what
that
you're saying, yeah.
nursing home door.
Yeah. There's already a waiting list of the retired, the rest homes that we have now. Give it another 10 years, and what's gonna happen.
Yeah, where are we gonna be? Maybe that's something that our county needs to start discussing now for the future of Coffee County.
gonna go back again to staffing, no matter what you do. I feel. I don't think the staffing issue is gonna get any better anytime soon, in my opinion.
Go back to what Joe said about people wanting to get out of the medical service. I'm on the state EMS board, and I guarantee you, EMS, which is ambulance and that stuff, they're having a lot of problems getting, recruiting people for that also. So it's not just here, it's everywhere. People that want to get out of the medical professions. That's why.
I feel the last 2 years of war, that was bad.
Yeah. So I think it has.
And there's a chance of it happening early.
I'm not saying we as Coffee County should look at that and do what we could and do,
I agree, Tom, but once again, you got staff.
but you still have to staff.
Yeah, I wish we could read the future, but we don't know what's happening.
Does anybody else have any questions for the hospital or the commission?
I offer this not as an answer for anything that we've talked about today, but just as a reminder to everyone how it's important for every one of us, I think, to be involved with the things that matter to us. And for example, our hospital board meets on the fourth Monday of every month. We only change it for holiday or something like that at 6:30 in the evening. And our meetings are always open to the public. Anyone can come and sit in on our meeting. If you want to speak for any reason, we would like to have a little advance notice so we can make a time on our agenda. But anyone is welcome to sit in and listen to our discussions. And every month, we talk about Sunset Manor. It's an item on our agenda. Likewise, with the county commissioner meetings, I did not pay much attention to them until I got on the hospital board, but now I know they meet every Monday, and their meetings are available on YouTube that you can watch them at home, and you learn I have learned all sorts of things by becoming more involved in that way. And so for the things that matter to us, those are things that might help us keep ourselves informed and those that we care about as well. And an opportunity to speak up if you have concerns about something.
Just to be,
He's on their regular agenda on a quarterly basis,
Yes.
and that would show up on the agenda that you can access on the website as well.
I'm just saying, this wasn't discussed though in the commissioner meeting.
I'm sorry.
And I just interject that it was never the intention of the hospital or the hospital board to close Sunset. Last year, the year before, or this year, even with all the financial crises that it was dealt, it was never their intention. And it was only recently when staffing became so critical that there had to be something done different. So you talk about transparency, there was nothing on the horizon that said, we need to tell these people, we're gonna shut it down. We didn't foresee that. Well, I shouldn't say that. We saw it coming, but we never thought we'd get to the critical point.
Right, but when I talk about transparency, I mean, it looks like 6 months ago, or a year ago, something should have been said that, to make the commissioners or someone aware that there was a potential problem there. I mean, that's what.
Right, I get it. And I think that in the discussions, nobody wanted to alarm people and say, in March, Sunset may close. You know what I mean? I mean, it's a delicate situation. This whole process has been a difficult situation in trying to involve the commission, Waverly, all the families that are involved in a timely fashion, because you can't do it all segmentally. It's all gonna be done kind of at once, because once I tell you, right? And so if I tell you and we haven't told somebody else, now they're upset because we didn't tell them in time. It's a logistical problem.
But because you didn't want to alarm people, now everybody is like a punch to all these family members.
Yeah, I get that, but like I said,
No, you
nobody,
don't get it.
well, I do because, my mother's in a nursing home as well. And I got you. Nobody foresaw this. Nobody planned this. And actually, we all planned.
Would you have wanted to see it 6 months ago?
What's that?
Your mother's in the nursing home, would you have wanted to see this coming 6 months ago? Or just have it dropped on you with 2 months?
Yeah, I don't know.
Yeah. When it's your own, you think about those type of things.
Well, and I agree with Rosemary, people need to be involved, but we didn't know we needed to be involved. We were kept in the dark. I think you failed. You failed our community, you failed our people that are in the nursing home, you failed the people that are working by not letting people know. I mean, I'm not saying that we can stop it from being closed, but we're just a community group that we work together. And if there's a problem, we work for ways that we possibly could have found, but you didn't give us the chance. We did not have the opportunity. That's what upsets me. This is not the way small communities work. We were failed. I'm sorry. A great, big, fat F.
Anything else? If not, we are going to go back to our commission chambers and resume our Monday meeting at 3:21. Which I
Thank
know.
the commissioners for their time today.
Thank you.
Thank you.
Thank you for coming.